Well, hello everyone. It's Chris Guerin with Splan, alongside Bill Holbert, my sales engineer. Today we're going to go over more of a vertical specific topic, which is hospital visitor management, and strictly, primarily talking about HL-7 connector and what that does in that environment. Today's agenda, um, obviously our introduction. We're going to talk about the challenges within a hospital. We're going to introduce ourselves and what we do at Splan for a modern solution within this vertical. We're going to talk about HL-7 and what that means in an EHR system. We're going to talk about authorized visitors for patients. And we're going to talk about how we can streamline the patient visits and even appointment visits. And then because we're a visitor management platform, we're going to discuss how we can manage vendors, contractors, and even temp staff coming in to the hospital. Then Bill will take us through a live demo, and then we're going to save time afterwards for Q&A. And once again, during the webinar, if you have any questions, please post those in the Q&A section, and we will address those at the end of the webinar. We're hoping this will only take about 30 minutes of your time today. So once again, thank you so much for joining us. So let's talk about the challenge, right? We all know we live in a world where there's increased security threats, especially in hospital environments. It's a gathering place, lots of people. Um, More and more, the visitor experience has become very important to hospitals. Obviously, compliance and regulation with HIPAA laws and how we audit and track everybody that's coming and going into the hospital. Um, Visitor flows. Visitor flows have become tougher and tougher. There's a lot of entrances into a hospital, and you're trying to manage and track all of that. Um, that comes with limited visibility and insight. So we want to make sure we can stay on top of that. A very big part of it is inconsistent enforcement, right? Do we know who's coming in? Were they approved? Did they go through the right process? And did we do that for everyone? And then, of course, outdated patient location management. Well, they said the person I'm visiting was in room 500. When I got up there, they were not because the data was not correct. So how do we fix that? So that leads us straight into Splan and how with HL-7 connection, how that helps. First off, it's a fast check-in for patient visitors with real-time updated information, and we'll explain that. It's enhanced security for the campus, right? Doing that same flow with everyone coming into the building and capturing that required information. We also streamline it, right? It's now simple. We know what we're doing. We have the same process, and we can get the visitors to the correct part of the hospital. And that all comes with seamless integration on top of the other things that we do within Splan. So with that being said, let's talk about what we do at Splan and core visitor management. I've kind of highlighted it for today's webinar in yellow. And as I often say, that's one part number, just core visitor management. What do we do? How do we work? So the first off, we are browser based and we're agnostic to that browser. So as long as you can get to the browser, you can get to what we refer to as Lobby Ambassador, our dashboard. We can be deployed in two ways. Once again, our software is agnostic to that. We can be deployed in the cloud, which is an annual subscription. We are SOC 2 and ISO certified, or we can be deployed on premise. You can host it on your servers or your virtual environment. It's a one-time perpetual license. We are multi-location and we are role-based. There's a hierarchy to the system for users. So from a pre-registration, not going to spend a whole lot of time because really hospitals are about patient visitors checking in. But from a pre-registration, we would send out an invite. That invite is very configurable to the system. We include Active Directory for all of your employees. And once again, when that invite goes out, there's also a QR code that comes to the bottom of that invite for check-in, and we'll talk about that in a minute. The biggest thing is a walk-in visitor. And when they go to the kiosk or they go to the receptionist, what that check-in experience looks like, right? We want to be consistent. We want to capture all required data. And we want to make sure that folks know where they're going in the hospital and they have a badge that says that appropriately. So at that check-in, once again, very configurable with those guidelines and requirements of what we do when we check them in. Obviously, their name, the patient that they're visiting, and then any other sort of information we want to gather. So once again, kind of in the middle of the page, at our kiosk, we have the ability to scan a QR code to auto-populate information from that pre-registration. We can scan a driver's license or a business card, once again with OCR technology in our system, to grab and auto-populate required data. We have the ability to do NDAs, informational videos, site-specific documents, and have that visitor sign it. We have the ability to do watch list, right? So there's internal watch list, and that is a fluid, active environment where it can be added and changed at any time with very specific instructions on a watch list. It could be Chris must be escorted at all times, or unfortunately, it could be something more severe where we need security involved and that person escorted off the facility. We include a VIP list as well, so that when a VIP comes in, maybe a notification goes to most people, to more people than one, excuse me. So speaking of notifications, we are an event-driven platform. So every action that happens, a notification can be sent. Core notification is email. We have the ability to do other notifications as well, text, phone calling, Teams, and or a Slack message, or any combination of. In a hospital environment, we talk about events. We can help manage events. And that gives you the ability to do third-party webhooks, track sessions within those events. Maybe if you're doing a fundraiser and you want to accept money, we can do that in that event management module. Package delivery, right? We can track those assets. We can check them into the system and make sure they get to the recipient and or wait for the recipient to come pick them up and check them out. Epic and Cerner and HL-7, very hospital specific, and that's really about what today's webinar is. We'll get to those more importantly in a second. But we also have the ability to integrate with your PAC system, right? We currently connect to 25 plus access control systems that gives us the ability to provision and disperse an access card and level within Splan without having to go into your access control system. We have the ability to support mobile credentialing, whether that's mobile or what we call wallet, NFC technology. We also support those with folks like Blue Diamond, Wavelinks, and HID. We have a ton of reports and dashboards. Bill's going to show you that. We can do visitor broadcast message and emergency notification, two very different things. And then we have the ability to help with some workflows within your facility, right? Not everybody can invite whoever they want, whenever they want to the facility. We can help with that workflow. On top of that, we have other things. We have the ability to do facial recognition. We can do COVID / a health screening questionnaire to determine how they answer those questions if we want to let them in. We can do employee temp badging. And then we're going to talk about it in a little bit, but we also can handle vendors and contractors and make sure that they're approved to be on site. So let's jump straight in now that you've kind of gotten an overall view of Splan. Let's jump straight in to what today's webinar is about. And it's Epic and or Cerner using HL-7. So Epic and Cerner are patient data information systems that keep all of that information and records of all the patients in the facility. And HL-7 you see in a lot of hospitals, that's kind of the middleware that takes all of those hospital enterprises and it rolls it up into one platform. And there's really three flexible deployment options, right? We can deploy straight into Epic and Cerner integrations, and we can do a couple of things with that. We can do SFTP data sync, or we can do our open API, which we are an open REST API stack with EHS, or we can go straight into HL-7. Now, the beauty of HL-7 is it is a live real-time transfer to Splan upon any patient data change or add. So it's real-time information so that when a visitor checks in, we know exactly where that patient is, right? And there's going to be a multitude of ways that we can do that check-in and so that we meet HIPAA regulations and we are secure in that. Once again, we do have other deployments where we're doing the data sync with SFTP, right? That's a pull from Splan, so we have to periodically go in and pull. It certainly works, but it's not real time. And then the EHS is the same way. So we really focus on HL-7. And what that HL-7 does is it streamlines that data exchange with the EHR system. It eliminates duplication. It helps us pre-populate that visitor information for faster registration. It's improved care coordination, right? We're not having staff trying to hunt down a patient, whether it's for meds or to transfer them. They know exactly where they are at all times. And once again, we're compatible with those leading systems, Epic, Cerner, and others. So HL-7 is the fastest, most reliable real-time feed that you can get in a visitor management solution for hospitals. And the beauty of it is, once again, I mentioned that we are an open REST API stack. It is all of the other integrations that we connect to help unify the platform, right? There's 25 plus access control systems. I mentioned mobile credentialing. There's cloud solutions. There's emergency notifications with Everbridge. Obviously, our healthcare connectors. And then Wi-Fi systems like Aruba and Cisco ISC. So we have these and many other connections that help solve those problems. So what does it do when we connect to HL-7? It authorizes visitors for patients, right? We have we can have the patient when they're checking in define their visitor list. So it's very important of who can come visit them. And unfortunately, in some circumstances, and even more importantly, who cannot visit them, right? That ties you into the watch list screening. So our system will flag unauthorized visits or individuals. Real-time alerts, right? Staffs are notified of these unauthorized visitors. Increased patient control, right? Not only do we manage their visit list, but we also have the ability when they're in a part of the hospital that they're only allowed 2 visitors, we can help manage that so that when that third person that comes to check in, we can go through a chain of events and workflows to let that patient know that visitor 3 is downstairs and we need to do something with one of those other 2 visitors. And once again, this is all about improved security, mitigating risk with associated individuals, and making sure we have a good flow within the hospital. We can also help organize patient visits and appointment visits, right? And admissions during pre-registration. We have the ability to do digital intake and then real-time updates. Once again, the integration with HL-7 makes that happen. Appointments, right? When we have patients coming on an outpatient visit to regular scheduled, maybe dialysis, we can pre-register and plan all of those dates, right? The ability to do mobile check-in and then automated reminders. So all of this, it helps staff productivity within the healthcare system, right? It's faster check-ins. It reduces administrative burdens, right? Once again, event driven with notification based on these events. Reduced paperwork. Once again, now you have historical data and trails and reports to make sure that things are going smoothly so that you can focus on patient care. And then we have all the other things that are in the background that a lot of folks don't think about, but that's compliance within a hospital and making sure that visit time policies are followed. Visitation policies are met, right? And that kind of leads to the number of visits per patient, depending on where they are in the hospital. A lot of hospitals have now limited the number of visitors per day, so we can help manage that. We've already mentioned watch list and how we can effectively catch those folks that are on that watch list before they get into the hospital. And that could be restraining orders and a lot of other things, but we meet the HIPAA compliance and GPDR, excuse me. So we meet all those compliance policies that are set. Now, I mentioned earlier about the ability to regulate vendors and contractors and temp staff. We have a module that I call that's native to Splan within the program that can help with the record keeping and tracking those vendors and contractors to make sure they meet the requirements to be on site. And we empower those vendors and contractors so that once again, we meet compliance, we can pre-register. We can make sure that they get credentials with the integration to our PAC system. If they're qualified, we can disperse a prox card. And then work policies, right? Types of work permits and checklists to make sure that the right people are in the building. So now I'm going to show you, before we get into the demo with Bill, our lobby check-in experience, right? We have the ability to integrate with cameras, passport, driver's license scanners, signature pads. We can take a QR code and we can do a badge read. And I'm going to show you a few examples of some of our kiosks, right? So this is a simple, what we call our tabletop. It is a little elbow stand with a case with an iPad that can connect Wi-Fi connectivity to get to the network and a Brothers Bluetooth printer. Once again, all of this is 100% configurable. There's a holder on the back of the iPad that lines up with the camera so that we can take data off that driver's license or business card to auto-populate that data. We have a freestanding model, does the exact same thing, except it's in a freestand, full height kiosk. The printer's inside, the badge comes out in the middle. It is an iPad. This is one of the few times I use the word customize, but if you want this wrapped in specific colors with a logo with specific wording around it, we can certainly do that for you. And we also have a very large unit, which is really not for hospital applications, but it not only can it print a soft badge, it can disperse a proximity badge. And what we see in hospitals is a lot of times it's a hybrid check-in, right? Because they want the interaction with the visitor. So a visitor will go to the kiosk, he will fill out some information and then step over to the registration desk. They will be greeted, informed about hospital policy perhaps, or tell them where to go, where the elevators are, and they'll hand them their badge, their sticky badge from there. So a lot of flexibility in what this looks like in a hospital environment and what that workflow does. What can Splan do? Well, we obviously have discussed in the hospital setting our HL-7 connection and what that means and the real-time data and the importance of it. So the time value is of the utmost importance. Brand imaging, right? If you talk to hospitals, that has become, there's a lot of department heads in hospitals, and that brand imaging has become very important to them. They want a modern visit experience, and they want to make sure that the data they get out of it is important to them and that they have real-time tracking and that they're secure. So it's really important that you follow HL-7 or EPIC or Cerner protocol in a hospital when you're checking in visitors for patients. So it looks like I've got 3 or 4 questions, so I'm going to try to wrap this up pretty quick, but we do have a couple of great questions. The first one was, can you categorize visitors by departments? And the answer is yes. Visitors can be easily categorized by departments. One of the options can be that you can put the department name on the badge in big bold text for easy identification, or a color printer and a colored bar signifies what area of the hospital they've checked into and where they should be going. So a lot of another question is, let me see, we maintain a number of visitors per patient in our Epic system. Is there a way that you can enforce that policy? Yes, we can. We've got a pretty easy way to enforce that policy. Whatever's defined in Epic, which we can grab from Epic or HL-7, will be enforced, like patient restrictions and any exceptions for hospice. We support that too. One more question here. As policies change, there might be a different set of questions. Can we modify the questions? Absolutely. The system allows for that configurability, and those questions and privileges. The admin has access to that and can change those at any time, or can use Splan's 24/7 customer support. So folks, want to thank you again for the time spent today. I know we've all got busy days in our lives. If you saw anything today that made you want to follow up and have a much more in detail question, this is our map of our sales folks. Pat's out west. I'm in the central. Jamie's east, and David is south. So please reach out to your rep at any time. We'd be more than happy to do a full blown demo for you and your customer. Once again, thanks for your time today. Make it a great